My name is Amy Knowles, and I am the Assistant Dean for Student Affairs and Admissions at New York University's College of Nursing. And it is my pleasure to be with you all this afternoon. I am honored to have been invited to your fabulous conference. And I am speaking in this workshop about nursing ethics. I have been very fortunate to have just completed my doctorate at New York University's College of Nursing, actually at New York University's Steinhardt School of Education. I'm employed at the College of Nursing. And my doctorate is an EdD. And an EdD is such that I was to focus upon a situation in my work environment where I felt I wanted to do a little bit of research so I could make an improvement in my setting. So my nursing students, I'm the Dean for Student Affairs and Admissions, would come to me and talk about how they were experiencing learning ethics. So I focused my doctoral research on baccalaureate level nursing students and how they experience learning ethics. So the title of my presentation today is Constructing Baccalaureate Nursing Students' Ethical Experiences of Classroom Lessons and Clinical Practice. So briefly, I'll be speaking in the next time frame. I'll give a little bit of background on my study, the purpose of the study, and what my specific research question was. I'll give a theoretical framework, the method I used to study the topic, what my findings were, the discussion of the findings, what my limitations of the study are, and implications for nursing education. And that's really the crux of an EdD. You want to make a difference in your work setting. Quite similar to the Doctor of Nursing practice, whereby you are implementing research that's already has taken place to make a difference where you're working. So, the background. First of all, the nursing profession itself is guided by a code of ethics. And there is a specific curriculum requirement, which is the Essentials of Baccalaureate Education for Professional Nursing Practice, that mandates baccalaureate level nursing students need to learn ethics. So, where I am employed, New York University College of Nursing, undergraduate nursing students are taught ethics for the practicing nurse, and that takes place through a variety of courses in one's junior and senior years. So while doing doctoral research, I went through the literature and I found that there is definitely a need for ethical learning, but there were very few studies done on classroom-based learning experiences. It was quite understudied how experiential or learning-based experiences in the clinical setting specifically linked to ethical lessons. So there was very little identification done, and there was a definition of the challenges that students were experiencing. So I knew there was this drive to find more information and to really add to the body of literature. So what I found, however, was that nursing students experience difficulties when they're transitioning between the classroom into the clinical setting. So, more background to instruct you, there is a code for ethics, or a code of ethics for nurses. And this really is the basis. This is what drives the instruction on ethics for baccalaureate level nursing students. This code of ethics has 9 principles. And the first being the nurse in all professional relationships really practices with compassion and respect for the inherent dignity, worth, and uniqueness of every individual. Number 2, the nurse's primary commitment is to the patient, be that a family or a group. Number 3, the nurse is to promote and advocate for and strive to protect the health and the safety and the rights of the patient. Number 4, the nurse is responsible for and accountable for individual nursing practice and determines the appropriateness of delegation of tasks. That's part of one's ethical mandate. Number 5, the nurse owes the same duties to self as to others. And what that means is it's really a nurse's duty to continually improve, learn, professionally grow. And again, there are 9 principles. Number 6 is the nurse participates in establishing and maintaining and improving healthcare environments and conditions of employment. Number 7, the nurse participates in the advancement of the profession through contributions to practice, education, administration, and knowledge development. Number 8, and this is a big topic nowadays, I'm sure you're hearing this all across the conference, and that's interprofessionalism. Number 8 says that the nurse collaborates with other health professionals and public in promoting community, national, and international efforts. So this is a big buzzword right now, interprofessionalism. And number 9, the profession of nursing, as represented by various associations and their members, is responsible for articulating nursing values, for maintaining the integrity of the profession and its practice, and for shaping social policy. So that's a hefty code of ethics. And the citation, of course, tells you that that comes from the American Nurses Association in 2001. The official title is the Code of Ethics for Nurses and Interpretive Statements. So that's the crux, that's the basis, that's the background. So with that in mind, I moved forward with my dissertation research. So the purpose of my study, I am an educator. I am first and foremost a teacher. I wanted to give my students a voice. So the purpose of my study was to add to, there was very limited literature. I wanted to explore baccalaureate nursing education, multicultural values, and the identified need to understand students' experiences with the learning of ethics in both the classroom and the clinical setting. So I had this dichotomy going on. I was always contemplating, that's how one learns ethics in the classroom. How is that in comparison to the clinical setting? Because nursing, baccalaureate nursing, is such that it's not just didactic classes. Students are out in the community setting or they're in simulated clinical experiences. So that was the purpose. Ultimately, I wanted to give my students a voice. So, with all of you who have done research, the doctoral level, you know that your research study is guided by a central question or questions. So my research question was, and this guided my 5 years of work, how do baccalaureate nursing students at a college of nursing perceive and then describe their experiences about classroom instruction in ethics and the ethical situations, that is, that they encounter in the clinical setting? So that was always guiding me. When I would type at my office computer, I had my research question at the very top of my monitor. So I could always go back to, everything was leading me back to this research question. Now, when you do doctoral study, you need to have a guidance of a theoretical framework. So I'm honing in on ethics. I turn to moral theorists. And the 3 particular moral theorists with whom I felt like I spent time, all the literature I read, Lawrence Kohlberg, Carol Gilligan, James Rest. Lawrence Kohlberg was truly the crux of my moral theorist reflection. He had built and written the cognitive developmental theory of moralization. He saw a need for students to operate as moral agents within a community by taking action and carrying out moral decisions. So it was more just than to think about ethical decisions, but it was action, how one actually moved forward in action. Carol Gilligan, in 1988, she built upon the work of Kohlberg, In her work, she asked youths to talk about their own moral experiences and their choices. And what that did, it confirmed for the youth that they did have a moral perspective of value. Oftentimes, working with young nurses, individuals in the college setting, they feel as though they haven't had enough experience to really be of value. Well, Carol Gilligan's work showed that, yes, youth have the ability to reflect and to act. James Rest took it a step further. He said that justice reasoning was not the only influence on moral actions, but there was moral sensitivity and moral character taking place. So, moving forward, I knew that nursing students pondering ethical decisions in the classroom setting was not the same as actually getting out into the clinical setting and carrying out the action. So, the method that I did a qualitative study. And what that allowed me to do was to really reflect on the nature and the meaning that baccalaureate nursing students themselves at New York University College of Nursing constructed as they themselves reflected on their own experiences. So once again, I wanted to give my students a voice. So I did a phenomenological approach. It's not quite a commonplace approach in qualitative work. When you do a phenomenological study, and I followed the style of Moustakis, you come to every interview with your student as a blank slate, so that each and every time you listen to a student talk about her experiences or his, it's something new. So you have to put aside your biases, and that was difficult, but I was able to do so. So, with phenomenology, that's a mouthful, you need to, of course, recruit your subjects, and in phenomenology, it's called co-researchers. So, I visited students in the fall of 2011. I interviewed, ultimately, final semester seniors. They had the most clinical experience. I went to the students' leadership and management class in the fall of 11, and I piqued their interest, and the students would follow up with me by phone and saying, yes, you know, Dean Knowles, I'm interested in being in your study. I was relieved. I was worried. All doctoral students are. Will enough people want to respond? They did. Thank goodness. Fall of 2011, 8 students were selected. I wanted to focus on a diversity for the gender of the students, their ethnicity and race. These were men and women who were enrolled in my 15-month accelerated program. That's the fast track for men and women who come into the baccalaureate program at NYU who already have a baccalaureate degree. So they come to me already with world experiences. Their final semester seniors, I ultimately selected 2 men and 6 women, 1 African American, 7 Caucasian. The age range was quite diverse, 25 to 51, and the average age of my students is 33 years old. I interviewed students. That was really the crux of my research. And I had researched domains, so that really guided what I was asking of my students. I wanted to know how they experience learning ethics in the classroom and also the clinical setting. And I also wanted to know, did they have any suggestions for me on how we could improve how we teach? So that was this practicality of an EdD. You want to make a difference in the work setting. So all of these factors kept coming into play. So I followed all procedures. The students signed consent forms. They then, when we interviewed, they reflected on their experiences, and they gave me some incredible experiences. For the short amount of time that the students were out in the clinical setting, what they were witnessing in our settings in New York City or in the simulation on the NYU campus were quite interesting. At the end of the data collection, I thanked all of my students, and they were in receipt thereafter of a bookstore gift certificate for NYU. So, when one does research, you're on a quest for salient themes. What's going to rise out of this? From your reflection on the literature, you have some idea of what may emerge. But the reality is, with phenomenology, you must come to each interview as a blank slate. And so, true to form, I was fortunate that salient themes came forward from my students, giving them a voice. What I learned. Number one, there were cultural factors affecting professional ethics. So that which is happening in people's lives and their cultures really came into play about their reflection on how they were making ethical decisions. I was quite sobered by the fact that my students felt marginalized in the clinical setting, and I'll talk a little bit more about that. Now, as an educator, as the Dean for Student Affairs, that was somewhat alarming. There were main ethical dilemmas that the students found, and it was due to time pressures. This world is so busy, and we're moving. I was speaking a little while ago, earlier, about how fast-paced New York City itself is, so a lot of time pressures. And there were medication errors going on in the clinical setting. I learned that there were some facilitators and barriers to implementing ethical nursing practice. Those particular facilitators and barriers are, when should we be teaching ethics in the curriculum? We must teach it, but when should we? This was quite potent. There was a classroom way of doing things and a clinical way of nursing practice. The ratio of nurses to patients was a theme that emerged. Oftentimes the students were saying to me, too many patients to one nurse. Are we giving the proper attention to our patients? That's an ethical dilemma. Life and death and patients' rights. There was no precise right or wrong with nursing ethics. The students were frustrated with that. They wanted a clear-cut answer. And insurance companies were determining the extent of medical care, and that was sobering to the students. So I'll just touch upon just a few of the findings. And I, again, wanting to give my students a voice, have a few potent quotes. The first was cultural factors affecting professional ethics. This is the wording of my student. She says, I think it's a difficult issue because there's a lot of issues of cultural sensitivity, respecting the rights, the religious beliefs, that is, and understandings of your patients. Discussing the religious beliefs with the patients so that we as caregivers could understand them and understand why this particular patient couldn't receive a blood transfusion. And also really explaining to the family why we thought the procedure needed to be done. Well, it's about navigating between a family's culture and religious belief system and the American medical system. And this is the wording of a baccalaureate level nursing student, not a registered nurse as of yet, but this clinical exposure allowed her to witness this grave dilemma. Here's a family with one cultural way of living, and yet the medical personnel are saying, you really should have a blood transfusion. Students grappling with cultural factors affecting professional ethics. Another quote. It was very clear to me, and this was, before I continue, there was an indication that a little girl was abused. And the student said to me how harrowing this was for her. Firstly, to think that this accusation was taking place, but had all sides been explored? Was abuse really taking place with this little girl who had been hospitalized? So the quote, it was very clear to me that there was a good relationship going, you know? There was no hesitancy on her part, and that's the little girl. She had calmed. She was sort of hysterical when I got there, and I just spent the whole day with her until her parents got there. I don't know. It did not seem like an abusive relationship to me. The allegation was such that the parents had been abusing this little girl, and she was hospitalized for dehydration. Well, the reality was, according to this student, ultimately determined it was a cultural factor. The family had been enjoying the little girl and had been carrying the little girl, and the medical personnel felt that the girl was quite stifled and had not been allowed to mature and grow. And the reality was, it was just in their culture. She was, in a sense, babied, but loved, truly loved. So the little girl was able to determine this. Another theme that arose: students feeling marginalized in the clinical setting. A quote: "A girl in my class was talking about how during her pediatrics rotation, there was a baby who had a type of wound in his abdomen. And the pediatrician came over to do rounds, and the pediatrician was touching in the baby's wound, but didn't have gloves on. So the nursing student didn't know what to do in that situation. She knew it was not okay for that pediatrician to not have gloves on. But also, you know, it was the doctor, and all of the med students were around the doctor, so what do you do in that situation? In this instance, the nursing student was grappling with feeling lowest on the rung in the hospital setting, not daring to speak out that this wasn't right, in her opinion. Another quote: "The nursing students are, I don't know if everyone else thinks of us this way, but we think of ourselves as being like the bottom rung. Even though, you know, we're getting this education, we're doing this, we're pretending to be real nurses for the day. Still, we don't know all of the policies of the hospital. We don't know what the culture of the floor is like. We don't know what's okay to point out. It's like if something's not exactly the way we read it or should be in the textbook." This is an example of a student feeling marginalized, such that does a nursing student, deeming herself at the bottom of the rung, really have the ability to speak out? Another theme, and again we talk about the fast pace of New York City, but I'm certain that this would be found anywhere: time pressures and medication errors in the clinical setting. Time pressures. A student quote, and this was a young man who quoted this to me. "I mean, there's a lot of stuff that we get taught in class, and I have a feeling that we will hardly ever have the opportunity to use a lot of that in the clinical setting. We probably get 6 patients more or less, and I see how nurses are running around, and they're very harried. They don't always get to take the breaks that they're supposed to have. It's got to be taxing. You can't be everywhere you try to be. You're not really like in a position to give the ultimate, what you know you're capable of doing. It's just not realistic." This student was grappling with time pressures, these ethical dilemmas in one's mind. You know that as a nurse, you're to give the best patient care. However, because of time pressures, this student was grappling with that, what he was seeing. And then medication errors. This surfaced a lot. Students seeing personnel cutting corners in medication distribution. Medication errors. Well, here's the quote. "Because the nurse that was doing it knew it was wrong, he prefaced what he was doing by saying, 'I know this is not what they teach you in class, but in order to get through meds, this is how we have to do it.' At a pre-conference, the Actually, the instructor also said, you'll see things on the floor, this is in the clinical setting, that are not best practice. But you know what is right. Just leave it as it is, because there's nothing we can do. Well, what happened is that the nurse in charge of giving the meds from one end of the corridor to the other to 16 or 20 different patients. So in order to do it, it's like usually more than one person to a room. They can have 2 sometimes, and they can have 4 to a room. So in order to timely give out the medications, the nurse would set them up in such a way. The nursing student telling me about this was quite sobered by the medication distribution, the potential for medication errors. The 4th theme, there were only 4. There are facilitators and barriers to implementing ethical nursing practice, and a few of them. When do we teach, or should we teach in the curriculum, ethics to baccalaureate students? There's a classroom way, and then there's a clinical way of nursing practice. The ratio of nurses to patients, that is an ethical dilemma it can cause. Life and death and patients' rights. There is no precise right or wrong, and that can be so challenging to an undergraduate nursing student grappling with, I want to know that there's a right way, and that's the wrong way. But with ethics, it's reflection, it's moral sensitivity, it's cultural influences. And then, on what was really a potent theme, insurance companies oftentimes were determining the extent of medical care. Just a few of my facilitators and barriers. The one that truly rose, all of my students spoke about it, classroom way versus the clinical way. Again, nursing students learn didactic lessons, and then they go out and experience them in the clinical setting. The student said, well, I think a lot of the times, and they always say, you learned how to do everything in a perfect way, the way it would be done in a perfect world. And that's not how it's always done. And most of the time, the professors, they're nice about it, but they're like, it's not always going to be perfect. You have to try to get everything done in a good amount of time. And I think a lot of the thing with us, almost everything we learn to do is a sterile technique. It's not always used in the clinical setting the way we learn it in class. And this can be a frustration for students. And another very major frustration, an ethical dilemma, is that of life and death and patients' rights. One student mentioned to me a situation that her professor had spoken to her about a DNR, a do not resuscitate order. Patients, upon entering the hospital before surgery, will be asked, do you have a DNR? Do you wish to have a do not resuscitate order? Well, evidently this patient had a DNR, but when the patient coded, it was not checked. Here's the quote. They didn't check the DNR before the patient coded. They did 30 minutes of CPR, and the patient still died. And she, the professor, was doing the post-mortem care. This CPR was so rigorous that the patient's rib had perforated her skin. She, the professor, found that out. The patient had had a DNR. This trauma to the patient was unnecessary. If that DNR had been checked, and here again, the dilemma, nurses are to check. The patient's rights are to come first, and this patient did not want to be resuscitated, and despite that order, the CPR was performed and a rib perforated the skin. So, a quick discussion of my findings. Themes emerged. I wasn't sure what themes would emerge. Those were the themes that emerged. And the good news was that they were heard over and over again. So there was definitely similarity to what my students were feeling. And what I was pleased with was the theoretical research that I had done, the framework, really served me well, because the concept of moral reasoning leading to action, which was discussed with Kohlberg and Reston and Carol Gilligan, I saw that. The theorists determined that moral reasoning, oftentimes measured by responses to dilemmas, it's really only valid for true theoretical consideration if it relates to moral behavior, acting upon what you believe your moral reasoning guides you to. As the nursing students experienced these clinical issues, experienced the ethical issues, the situations and the dilemmas, both in the classroom and the clinical setting, they applied their moral reasoning that would have resulted in what they believed to be appropriate moral behavior. So there's that movement from your reasoning to your action. But a caveat must be noted, and I put it in bold. I don't know if it shows up quite clearly on the PowerPoint. A caveat must be noted. In real-life situations where power differentials exist, remember my students mentioning, I feel as if we're on the bottom rung of the totem pole, or the ladder, the bottom rung. They were feeling lower than, less than the other healthcare professionals. So in real-life situations where power differentials exist, student behavior was not only determined by their moral reasoning, but by real-life limitations and their perceived consequences of acting upon their moral reasoning, which truly ultimately determined the outcome of each experience. So when the students were feeling, I don't know if I have the experience enough to really speak out, that truly served to limit their moral action. If the students did not perceive that they could actually act upon their moral reasoning because of the circumstances or that power differential, they described frustration, and that came out loudly and clearly, and a little bit of disillusionment with the conflict of their education versus reality, what they were seeing in the clinical setting. There were limitations, and there always are limitations with a doctoral study. Most of the students' experiences, that is, with ethics, took place in the clinical setting and not in the classroom setting. Students were quite critical of that fact. They said, we're talking about ethics really in a limited fashion in the classroom. I'm seeing ethical dilemmas in the clinical setting, but I'm not talking enough about it in the classroom. Now, I collected the data in the fall semester, and that happened to be a battery of second semester seniors, and they're all second degree. You see, one can enter NYU's baccalaureate program coming right out of high school. That would be a 4-year program. Or this 15-month accelerated program, which is a 4 consecutive semester. Those were the men and women I interviewed. So that did add a limitation to my study. These were older, second degree adult learners. My sample size was 8 students, so that was a little bit small. In my role, I am an assistant dean for student affairs and admissions. Been at NYU now, this is my 10th year. It informed my study, but it may have introduced some of the biases, such that I wanted to give my students a voice. I had been hearing my students talking about ethical dilemmas for years. So, this is the ultimate crux. You want, with an EdD, to make a difference, a change in your work environment. So from my years and years of study and my years of writing, here is what surfaced. Implications for nursing education. The concept of clear communication between healthcare providers and patients and among healthcare providers themselves needs to be addressed. We hear it all the time. Clear communication, expressing one's beliefs, one's actions. Clear communication necessary. I also found that it would be quite helpful if baccalaureate nursing students were educated in assertive communication. If this could be taught in the classroom setting, giving the nursing students the opportunity to perhaps role play different conversations so they felt comfortable talking with the patients. They felt comfortable bringing issues to other healthcare members of the healthcare team. When they saw something that didn't seem right, assertive communication would help empower the students. Another implication, instructing students. Before they go out into the clinical setting, teach them. Unfortunately, harsh treatment by other members of the healthcare team can exist in what they should do when that mistreatment does occur. Teach the students what you're learning in class, in theory, may not be the practical way of doing a procedure in the clinical setting. What they learn in class, though they are being taught the correct way to distribute medication, for instance, in theory, because of time pressures and real life in the clinical setting, they may not be able to distribute medications. It could be in opposition to the best practice they were taught in class. And because of time pressure, another area where students grappled, they may not be able to spend as much time as they would like with their patients. And they need to be as clear as possible in communicating to their patients and be succinct in the assessment of their patients. To facilitate ethical nursing practice, one of my findings is ensure that nursing students discuss ethics throughout all of their clinical courses. Talk about it, and specifically have seminars focusing on ethical topics. And nowadays, we're beginning to do in nursing education more clinical simulation exercises. This is an excellent vehicle, an excellent venue by which students can practice how to act when they're experiencing an ethical dilemma. Clinical simulation exercises can take place on topics that deal with nursing ethics. It's another way to ensure that nursing students will have reasoned through various ethical dilemmas before they graduate and enter into the workforce. And lastly, there can be voluntary educational activities such as Ethics in the Round. We do that at NYU, and I've been very fortunate to participate. It's an opportunity for students to bring an ethical dilemma, a situation that he or she has experienced in the clinical setting, among colleagues during, it could be a brown bag lunch, to talk about, here's how I handled it, what might you have done? And it's so empowering for students to have that opportunity to share with each other what their experiences have been. And this really is designed to facilitate ethical decision-making and to help students hone their skills. And this could be added to the baccalaureate nursing curriculum. So I thank you all very much today for your interest, and it has truly been a pleasure once again to not only be presenting to you my dissertation findings on this very important topic, nursing ethics, but also to be a participant in this wonderful conference at UC Davis. So thank you once again. I am Amy Knowles. I am a recent Steinhardt NYU graduate with her EdD in Higher Education Administration. And again, my focus was that on nursing ethics. And I thank you very much for your interest today. Thank you.